Hi everyone, my name is Mary and I'm the health educator here at Arthritis New South Wales. You might recognise me from some of the previous webinars that we've held. Today we're going to be talking a little bit about mental health and arthritis. So I just want to make sure that we put out a disclaimer, and it's just to remind you that all the information here is to basically give you general information and advice. Every effort has been made to ensure that the information we present is accurate, it's backed by evidence. And so the idea is that the content of this presentation isn't a substitute for individual treatment advice. If you do have questions, if you do have anything relating to your own medical condition and your own treatment, always make sure that you consult with your doctor or your main healthcare provider to talk about those questions and seek out support. I do just want to give everyone a heads up that today's seminar will discuss themes of anxiety and depression. And so, if this at any point brings up any distressing feelings for you, at the very end of the presentation, we have a range of services and support lines that you can call, websites that you can look into, find resources for extra support. So they will be available at the end of the presentation. Now, we're going to be going through what is mental health. We will be talking a little bit about the relationship between stress, anxiety, depression, and arthritis, and what that intersection looks like. It's more of a catch-22, and I do want to break that down a bit further. Towards the end of the presentation, we'll be going through some coping strategies for emotional difficulties, mainly speaking to things like mindfulness, deep breathing, mindfulness-based cognitive behavioral therapy, and we'll be going through some mental health services and support. So let's start off with the definition of mental health. So mental health is a foundation for well-being and effective functioning. It's defined by the World Health Organization as a state of well-being in which the individual realizes their own abilities and ability to cope with normal stresses of life and can work productively and fruitfully and is able to make a contribution to the community. So that is its very primary definition. But basically, our mental health, it affects how we think, it affects how we feel, how we act, and it can affect things in our everyday life. It can affect how we work. It can affect relationships, our social life, our ability to study and learn things. And so when we have a chronic condition, it can make these things a little bit more challenging. And so we can have good days, we can have bad days. And for some people, it's very normal to have these days where they feel more happier, more energetic, more positive, as well as days when they might feel a bit down, a bit stressed, less motivated. And so there are fluctuations. But when we have chronic conditions, it can be very hard to understand these fluctuations and adapt to them. So, living with a chronic condition like arthritis can impact mental health in many different ways, which can lead to a lot more frequent and persistent fluctuations in our mood and emotional states. And that's what I do want to talk about a little bit more. So, arthritis can cause a lot of physically debilitating symptoms, and what isn't spoken about enough are the most emotionally and mentally debilitating consequences of those symptoms. So, having arthritis is one of many risk factors for anxiety and depression. Other risk factors can include if you have a family history of mental health conditions, if there's any stressful life events happening. Personality factors can also trigger anxiety. There are many different risk factors that are known. Sometimes stress and anxiety can be perceived as very normal, and we don't often seek out mental health services or treatments for it. And so when they're left unaddressed for very long periods of time, stress can increase the risk of anxiety, and anxiety can increase the risk of developing depression. Anxiety um, is characterized by feelings of tension, worry, irritability. Um, there can even be physiological responses to anxiety, like increased blood pressure. We can also experience times where there's an increased heart rate, increased sweating. So, um, not only is it um, a, men- a mental and emotional, but there's also physiological kind of responses to these changes in mood. With depression, it's typically characterized by sadness, lack of interest in activities, weight loss, weight gain, sleeplessness, excessive sleeping, lack of energy, irritability to concentrate, and there are a few more. And, occasionally stress and anxious feelings are very normal, especially in situations where we feel under pressure, we're faced with certain stresses in life, if we're feeling uncertain about maybe the future and what it has in store for us. Sometimes our symptoms of arthritis can um, cause stress and anxious feelings. Like if you're waking up one morning, you have severe bout of stiffness, reduced function in an affected joint, you're feeling a bit worried about what the day has in store for you. Or maybe you're worried that your day is going to look a little bit different than you've anticipated, especially if you have an event coming up. Um, Once the stiffness has passed, your worries have settled, um, these nervous feelings have settled. This is an example of bouncing back from adversity and coping with an acute stressor. What anxiety is, it's more than just feeling stressed or worried. Anxiety is when these feelings don't subside, and it can make it really hard to cope with everyday living, can make it hard to cope with your diagnosis at times. And these feelings can't be easily controlled. If you're feeling unsure about whether these symptoms are actually anxiety or eventuating into depression, seeking out professional support is so, so important and can make all the difference to your overall health and well-being. Not only can it help you get an accurate diagnosis, can give you a peace of mind. So uncertainty about not just your symptoms to do with arthritic joints, but symptoms to do with your mental health, increased anxiety, distress. The professional support can give you clarity and it can give you peace around this and a better understanding of what you're experiencing and how to address it. Can help with preventing escalation. So anxiety symptoms can worsen over time if they're left untreated. And so seeking support early on can actually help with preventing any escalation of these feelings. You can also learn and pick up effective coping strategies. And so we're going to touch on that a little bit more in today's presentation in terms of relaxation exercises, mindfulness, and cognitive behavioral therapies. These tools are really effective for helping empower you to better handle and reduce anxiety symptoms. Symptoms of anxiety conditions and any mental health disorder are sometimes not very obvious as they do often develop over time. And it's hard to differentiate what is a normal level of anxiety in comparison to an anxiety disorder, which may require treatment. So, anxiety is one risk factor for depression, and in some people, they experience these simultaneously. Depression is different in that it's more than just a low mood. It's a serious condition that can have an impact on both physical and emotional well-being. And while we all feel a little bit sad or moody or low from time to time, some people can experience these feelings more intensely for longer periods of time. It could be weeks, months, maybe even years, and sometimes it's without any apparent reason. Depression can affect the way you feel about yourself. It can make life a little bit more difficult to manage from day to day. You might lose interest in things like work or things you've previously enjoyed, hobbies. It can also make it a little bit more difficult to deal with your diagnosis or even adhere to something like your treatment plan or treatment regime. So, what I want to touch on is how it relates specifically to arthritis. And what's important to recognize is that the rates of depression and anxiety affect a very large proportion of people living with arthritis. It's approximately affects around 2 out of 10 adults with arthritis. So that's a large proportion of adults who live with a mental health disorder and also have to live with arthritis. This is where I think it's really important that we acknowledge and we understand the catch-22 here. So, we have a complex relationship in the way arthritis affects mental health, but mental health can also affect arthritis. And so, this relationship is very layered and it can be very difficult to break. And so, what I want to do is unpack this a little bit further so we understand this bi directional relationship and how complex it actually is. So, if you have arthritis, you probably recognize that it can hurt a lot sometimes. It can limit your ability to do some things. It can make you feel very lonely at times, isolated, can leave you feeling a little bit worried about your future. Sometimes these feelings can make you feel really down, and for some, it can come in bouts, but for others, it can really persist. What's often not acknowledged is how feeling down, anxious, and stressed can actually make it really difficult to live with your arthritis. It can make your arthritis worse. And is a biological explanation for this that I'm going to get into a little bit more detail about. So we have a lot of recent studies that have shown that anxiety and depression are linked to having a lower pain threshold. What this means is that for some people, even just mild or moderate pain can be experienced more intensely, can be more bothersome. And we see this in people with mental health conditions. But then what's tricky is that it is often driven by the chronic pain that's being experienced. And so they know that chronic pain is a very a significant risk factor for anxiety and depression. So what happens is you can find yourself in this never-ending loop of pain, poor health, and negative mood. And so this vicious cycle, acknowledging it can really change the course and management of your arthritis. And so, as we go through this presentation, I'm going to throw some concepts around that help explain this a little bit better in terms of what's happening in terms of pain, what's happening with the brain. And, for some, it can be a little bit tricky to grasp. And I don't want to say that, pain is not it's not valid or it's just in your head. I want to bring in the biology, what we know about research, what we know from the statistics, so we can understand this relationship. And this is so we can understand the importance of addressing mental health. So we have many, many studies that show people who live with arthritis have and experience the highest pain levels are more likely to be anxious or depressed. We also have studies that they also tend to have more functional limitations like pain, stiffness, reduced mobility, reduced function. They also tend to avoid display more avoidant or counterproductive behaviors like not adhering to a treatment regimen. For some, They tend to be less likely to take medications, engage in exercise, follow a healthy diet, all which are very common in depression. So the link between pain and depression really go hand in hand, meaning that they can contribute to one another's onset and they can also exacerbate one another. What's really interesting about this link is that they share very common underlying neurological and biological mechanisms. And that's something I do want to touch on a little bit more in the context of arthritis. So I'm sure that some of us can acknowledge that living with daily pain and affected joints is very physically stressful, but it's also very emotionally and mentally challenging. And so, arthritis symptoms are certainly a real concern for people. They can cause a lot of stress, but then those feelings of stress and anxiety can further fuel those symptoms. And so, I want to take a deep dive into this. And I do want to start with looking at this body's stress response system. So, stress is our body's response to perceived threats or challenges. And what happens is it releases many brain chemicals, nervous system chemicals, and hormones to help adapt to stress. And we all feel stress sometimes on days when we have maybe physical limitations. There might be stress and anxiety around starting a new medication. If you haven't had a good night of sleep, all these things can cause acute stress. Chronic stress is different in that it lingers and it lingers for extended periods of time, which can be weeks, months, even years, and it has compounding effects in our nervous system. So, this is where I want you to think of your body and your mind as a light bulb. A light bulb is designed to be turned on and off as it's needed. When it's on, it lights up the room. When it's off, it gets a chance to cool down and rest. I want you to imagine that chronic stress is a situation where the light bulb is switched on, but it's not turned off and it's left on without any breaks. Imagine it's shining bright all day and it never gets a chance to cool down. Over time, this can cause that bulb to overheat, flicker, eventually burn out. So, this is what can also happen to our nervous systems when you're in a state of chronic stress. And so our stress response system involves the release of many stress hormones, like cortisol is one. And these stress hormones are constantly being produced in response to the stresses. And this over time is known to cause changes in your levels of brain and nervous system chemicals. These stress hormones and neurochemicals like cortisol, serotonin, norepinephrine, might have heard of those before. They're basically chemicals that can significantly affect your mood. And when the balance of them is disrupted, it can bring on anxiety. It can lead to depression. It can alter your behavior. It can make you less likely to exercise, adhere to pain management strategies, all those behaviors I mentioned before. In a way, it can also directly and indirectly affect your pain. Over time, this chronic stress can really wear down someone's ability to cope with stresses and it can send our nervous systems into overdrive. So, our nervous system is a very complex network that's always processing and taking in information about our body. It's doing all the things to make sure it's internally regulated, it's calibrated, and there's always a check and balance of all the resources we have to deal with stress. But when it goes into overdrive, which is what can happen in anxiety, it can make us actually a lot more sensitive to pain signals over time, despite having no worsening pathology. And there's physiological responses to this overdrive. It can cause constant activation of muscles, increased tension. It can also lead to comorbid symptoms like IBS and depression. So it can affect many other systems in the body as well. And once it's in overdrive, it can be really hard to regulate, and it's associated with a high risk of a number of different health issues, including cardiovascular problems, can compromise the immune system, it can affect our digestive health, and increase the risk of mental health conditions like anxiety and depression. And this is why it's really important to make sure you're seeking out appropriate treatment and support so we can recognize these symptoms, we can receive an accurate diagnosis before it eventuates. Now, I hope we're all staying with me here as we continue to explore the pain and the brain relationship. So, the pain is the brain's assessment of safety. It's there to serve as a protective mechanism when your body detects a potentially harmful stimulus. So, when you put your hand near a stove, I want you to think about what happens. Imagine you're feeling extreme heat. Your arm, you'll notice, pulls away almost immediately. In that response, your brain has actually assessed the situation, it's evaluated the heat and the potential risk to your safety. So it's your brain that's really told your muscles to pull your hand away from the stove so we can avoid potential disaster and avoid any further injury. Pain is a very complex experience that's finely tuned by the brain. Now, when our brain and nervous system are in overdrive, it can become very overprotective when we're receiving a pain signal, which can become a bigger problem than perceived. So, what I want to show you here is this image. You can see a knee joint with severe stage of osteoarthritis. What is interesting is that some people may present with this in a scan, will report maybe a 9 or 10 level of pain. There are some other people with the exact same scan and the exact same progression of disease who report maybe a 1, maybe 3 on a bad day. So, what I'm going to is that, pain is absolutely valid. It's, there, we need to understand what pain is there to do, but it's not always a reliable signal for what's going on. And this is why we say pain doesn't always equal damage. And, that thought of pain creating more damage, it can be very stressful and it can create a lot of anxiousness around the condition. It can create a lot of anxiousness around engaging in things like exercise. But we need to stop thinking of it as an automatic proportionate warning about tissue damage, because pain is very rarely to do with one single source of tissue damage. We have to acknowledge the role of everything else that's going on when it comes to pain signals. And how this ties in with mental health is that anxiety and depression can very much influence the way the brain is processing information, the way it's responding to pain, and it has a large role in turning up or dialing down the pain volume. So, it can alter things like pain perception, it can alter protective mechanisms, it can influence behavior. And so, when someone's living with anxiety, it can make people more sensitive to pain. They can perceive pain as being more severe or intense than it actually is, and it can make the pain feel overwhelming. And what happens in people with anxiety is that they do tend to engage in things like catastrophizing, where they exaggerate the negative aspects of the pain. So if you're living with an affected knee joint, you're having a really bad day and it's painful, it's osteoarthritis. It can be very daunting to engage in exercise and you could get a lot of anxiety around that idea of having to move that joint and to relieve the pain. Now, saying that, with inflammatory types of arthritis, it's really important to recognize that that pain could be a signal for you to rest. Um, you know, when you have an inflammatory type of arthritis, you need to recognize that pain is a signal for you to take a step back and basically rest that joint. What's important here is that we recognize that it's a bad day, we accept it, and we're able to overcome it, and we don't let it become distressing to us or emotionally taxing. With depression, it can work in the same way in that it amplifies the perception of pain, making it feel more intense and persistent. But it's because depression can change the way the brain is processing pain signals, making it harder to manage. And so it's really important that we really get to the root of why we're experiencing this pain, but we also acknowledge the role of mental health here. So pain itself can really change the way the central nervous system works. It can become a lot more sensitive. Um, it can influence that experience of pain. This is where I'm going to introduce something called central sensitization, because it's all about what changes are happening in the central nervous system, in particularly the brain and the spinal cord. And it's a very, very challenging complication in arthritis, but we have a lot of research that actually explores the way it manifests in rheumatoid arthritis and osteoarthritis. So, pain is an absolute valid warning system. It needs to be read very carefully. But from the research we have so far, we see that sensitization is probably the explanation for the spread of pain beyond the joints in people living with RA. And we say probably because it's very hard to obtain that tangible evidence in the research. In osteoarthritis, we have a lot of research that actually compares experiences of people living with arthritis, and it looks at the emotional and psychological impacts of their condition. A lot of collective findings have suggested, um, you know, this is why it's important to address mental health needs of individuals living with these conditions, because the symptoms aren't always solely to do with an arthritic joint. Um, and I'm going to touch on this specific research in the next slide. But if you're someone who experiences bad days, you feel a little bit more pain than actually makes sense, I want you to think, be able to read that carefully. Is it something that is legitimately due to the pathology in your arthritic joint? Or could it be the nervous system is playing up? And so, what's important here is that you're seeking out the support and the help from a professional who can help you make sense of this. It's important to really differentiate legitimate pain or the sensitization to pain. So let's take a look at this research that was done in 2019. They looked at self-reported data of 1,471 people who were diagnosed with knee osteoarthritis. This self-report measured traits of anxiety, depression, catastrophizing, neuropathic pain, fatigue, sleep disturbances, pain distribution, and cognitive impact. And each trait was associated with pain intensity, and they looked at clinical and experimental markers for central pain mechanisms in those who were reporting on knee pain. What they actually found is that people who had higher amounts of these self reported traits, like had high levels of anxiety, high levels of depression, catastrophized more, they actually had more severe and persistent knee pain. And so this again goes back to that central message of making sure we're addressing underlying factors that influence pain so we can optimize the pain management and the course of illness. It's also important for the behavioral aspect, the emotional aspect. Some researchers suggest that these traits can actually help predict pain outcomes. So what you're seeing here is a tool that's been used for people to check if it's sensitization or actual pain. So to a surprising degree, this checklist has been used to see if you're sensitized to pain or if it's actual pain, and it's meant to help predict how bad your diagnosis could get in a year's time based on how many boxes you have been ticked. So if you have no obvious cause for your pain, no recent injury, no known source for the pain, if pain is chronic, it's out of proportion, you're finding yourself being more pessimistic about your diagnosis, you have a lot more worries, maybe you find yourself engaging in catastrophizing. This is something that should be enough for you to talk about with a health professional. And it's definitely valid in terms of the course of your disease management. Medications for mental health are increasingly being used in chronic pain management, and so it's really important that we understand the role they play and what they are used for. So there are actually lots and lots of medications available, and they all function in different ways in order to help manage anxiety and depression. We have first line treatments for anxiety and depression. We also have second line treatments, which are an older class of drugs. And I'm not going to go into that today, but some of these medications are used in those living with a chronic pain condition, not just due to helping things in anxiety and depression aspect of the condition, but also helping achieve analgesic effects on chronic pain. And so anxiety and depression can absolutely be treated, and it's important that it's important you work closely with a healthcare provider to weigh up those benefits, those risks, those side effects, and they're prescribed on a very personalized level. Um, Often the prescription of these medications are used in combination with physical therapies, counseling, and many lifestyle modifications for a comprehensive pain management program. So, coping strategies for emotional difficulties and mental health challenges can vary widely depending on individual preferences and the specific issues being faced. It also depends on the severity of the mental health disorder, the severity of anxiety or depression. And what you're seeing here are just some of the many effective coping strategies that are used as a in part of a comprehensive mental health plan. And so it's important to remember that what works best can really vary from person to person, and it can take some time to find the most effective strategy for yourself. But things like mindfulness, deep breathing exercises, progressive muscle relaxation, journaling, um, talk therapy, seeking out support groups, engaging in exercise, eating a healthy diet, ensuring you're getting enough adequate sleep. finding creative outlets, positive self-talk. These are things that are known to help with building mental health resilience. These are the things that are encouraged to help you bounce back from adversity, cope with stresses, and maintain that emotional well-being in challenging situations. You'll see they're often recommended in pain management treatment plans as well. And so by now, after covering, the relationship between anxiety, depression, arthritis, looking at what's happening in the nervous system, I hope we've asked ourselves some question, and we somewhere along the way we've wondered about the role of mindfulness. And so if our brains can create pain, I hope you've asked yourself if the brain can create pain relief. And so this is why we go back and we talk about mindfulness, because it can benefit anyone and everyone, especially in the management of anxiety and depression, especially if it's associated with a chronic pain condition like arthritis. So there's a lot of different studies that suggest that mindfulness-based interventions are useful strategies to improve psychological distress, depressive symptoms, self-efficacy, so improving behaviors that are going to be positive and productive for managing living well with arthritis, well-being, improving quality of life, helping with pain intensity and the ability to cope. There is even some research that's looking at how it can be effective for disease activity at the cellular level. So we're talking about its role in controlling inflammation and even the response to exercise interventions. So these are recurringly indicated in a multidisciplinary treatment approach, and there is a science to it. Not only do mindfulness interventions help improve emotional regulation, it plays a part in alleviating psychological pressures, alleviating the pain response, and regulating that nervous system and improving the quality of life and well-being. So in more recent times, they're applying these interventions and these strategies to comprehensive treatments in a number of different fields. And, there is very strong evidence to suggest it can have a beneficial impact on people living with arthritis, whether it's non-inflammatory type of arthritis or inflammatory type of arthritis. It has proven to achieve remarkable results in the most recent research applications. We have a total of 6 randomized controlled trials that have looked at 337 patients. The results from these randomized controlled trials all share a similar message. It's all pretty much overlapping in terms of your pain intensity is often improved in people who are employing mindfulness strategies and techniques, and the results are significantly better in those groups in comparison to control groups who aren't applying any mindfulness in their pain management or in their mental health. So mindfulness is to be able to direct our awareness to the present. It's to be here and now, accepting your diagnosis, accepting negative or thoughts and letting go of them as well. It's basically letting go of feelings and employing distraction. So it's really a state of being. And so practicing mindfulness really helps let go of thoughts and emotional responses to them, including the ones that cause stress, increase anxiety, even depression at times. So there's profound benefits in this intervention. And so it's also incredibly easy to implement. So there's a lot of scientific literature that supports the benefits of these interventions in people with chronic pain conditions, anxiety, depression, addictions, ADHD, and pain. And there is, scientific explanations for them. And so it's always worth seeing if it works for you. Now, these are just some of the many interventions that can be applied. These are very popular techniques used when we're employing mindfulness-based interventions, breathing exercises, guided imagery, daily mindfulness. These are things that can also be guided with the support of a health professional. There are also resources you can access online for free. You can access podcasts, videos. There are many tools that you can find available to you to basically help you get started. So, in our next webinar, we will be talking a lot about mindfulness-based interventions and taking a deeper dive into different techniques and strategies. But I do want to go back to the importance of it and how it can benefit mental health. So just an example here, we have a flowchart that illustrates what's happening when we're not mindful. So you can see that when there's a first sign of stress response, it's really important that we're able to recognize it's a stress response. Recognizing and managing a stress response is really important for long-term health and well-being and getting through the day. Mindfulness is what is really going to help us catch that stress response more quickly. Um, and we notice this by what's happening to our breath. Usually, our breath is the first sign that we're having a stress response. For instance, when we start to experience a stress reaction or we start to feel anxiety, and it could be provoked by anything. If you're living with chronic pain, if you have plans for a day, but you're not sure if you can go ahead with them due to symptoms playing up, you might notice subtle changes in your breath. The breath tends to either get held, we hold the breath, or it becomes a little bit shallower. Sometimes it moves higher in the chest. If we can recognize changes in our breathing, then we can recognize that, okay, there is a stress response happening. If we don't notice changes in our breathing, there is a part of the brain that actually keeps continuing to fire away. So this is when things can escalate and they can turn into a full-blown panic attack. Going back to why it's so important to recognize what's happening around us, what our body is doing, and if it's a stress response. Often when we're under stress or we start to feel anxiety coming on, there is actually physiological responses. We might feel the heart rate increase. We might start to feel sweaty. We might notice those changes in our breathing. Blood pressure can rise. This can also eventuate into cognitive changes. It can lead to us catastrophizing, ruminating, worrying about the future. This is where mindfulness can help us take a deep breath. We can check in with ourselves, what's our attention caught up in? As soon as we're aware that we're having a stress reaction or an anxiety attack, we're able to immediately disconnect from it. So it's all about really making sure that we're asking these questions to ourselves. What's triggering this? What's my attention caught up in? If it's something like pain, or you're worrying about something that might be happening in the future, this is where we can really get caught up in this self-criticism. We can be really worried about what's happening. It's important that we simply redirect our attention. And what happens in the brain is that it can wander again, almost probably straight away. And this is because our mind is always going to keep worrying about a stressor. But as soon as we noticing that it's wandering, we then have the opportunity to bring it back. It will wander off again, but it's up to us to bring it back. And so we do this over and over again. But if you're finding yourself struggling with this ability to bring our attention back and, um, calm down. You struggle with things like breathing, um, and employing these mindfulness techniques. There are people there who can help you recognize your stress responses. They can help you with find techniques that can be implemented almost immediately when you have these bouts of anxiety, you experience extreme stress, and it can help you get to this point where you recognize that you're actually safe, you're accepting what's going on. It can help you bring you back to the present, bring your attention back in, so you can have more control over your anxiety. Mindfulness-based stress reductions with cognitive behavioral therapy. It's basically the merge between mindfulness, but also addressing some of the negative thought patterns with alternate ones. And so it's combined with a structured psychological treatment approach, which is all about recognizing that the way we think, the way we act can affect the way we feel. And this is used often for the management of anxiety because unhelpful thoughts and behaviors can lead you feeling more anxious, which can stop you from getting better. It can stop you from preventing an escalation. And so it can also amplify the pain you experience. And there is a scientific reason why we talk about using mindfulness and CBT in pain management as well. So, by working closely with a therapist, you can learn to identify unhelpful thoughts or behavior patterns and help you replace unhelpful thoughts and behaviors with new ones that reduce your anxiety and indirectly pain. And so, these are some examples. You might relate to some of these statements. You might recognize that, hey, this is the way I think sometimes. My knee hurts, not again. How bad this time? So if you find yourself asking yourself these things or making these statements, um, you might feel an incredible peace of mind once seeking out the appropriate support and the help from a therapist to talk about this. Now, this is an example of how um, to implement mindfulness-based cognitive behavioral therapies. And these are just some of the techniques. And you can see that what's happening is you're recognizing a stress response. You're recognizing what you're doing, whether it's catastrophizing, whether it's rummaging negative thoughts, and it's associated with your symptoms, your pain, your condition. You can see how you know, these examples are another way of thinking about what's happening when you are having a stress response. It's acknowledging that it is an actual stress response. It's recognizing that there is something your attention is caught up in, and there's ways to overcome that. And so it's really good to actually speak to someone to help you simply acknowledge what's happening, practicing acceptance and letting it go. That's essentially the root of mindfulness. It's there to help break patterns of negative thinking, which can not only make stress, anxiety worse, it can lead to depression, but it can also make pain worse. And so it can help you really break this vicious cycle. Going back and thinking about that catch-22 we spoke about earlier on. So, mental health services and support that's available. We have Lifeline, Beyond Blue, Black Dog Institute, and Mind. These organizations all offer very helpful resources. There's hotlines to call, and they're available 24/7. So, not only can they give you tools and resources to understand what you're experiencing, and effectively manage the mental health challenges that you're facing. But seeking help is really a sign of strength and courage, and it's absolutely okay to ask for support when you need it. And that's what these services are there to do. So there is online therapies available for anxiety. If you have mild or moderate anxiety, online therapies can be just as effective as face-to-face services. And so most online therapies follow the same principles as cognitive behavioral therapy, and you might be provided with a program to work through by yourself, but usually there is some support from a therapist. And so the therapist is there to help you apply what you've learned to your own life. You might talk to them over the phone, by email, text, or instant messaging. There's a number of ways to actually communicate with them. But the best thing about these services is that they're easy to access, they're always available, they can be done from anywhere in Australia, in the household, maybe even um, in a private location at work. Usually, you don't even need a referral from the GP to engage in these. So, online therapies can be very beneficial, and especially if it means improving mental health, because we know that mental and emotional well-being can significantly impact overall quality of life, but it can also impact on the management of your condition. And so, there are a number of reasons why, focusing on mental health should be an essential part of your um, arthritis management. So, this is just a summary. Stress and anxiety and depression are very, very common in those living with arthritis. And there is a bi-directional relationship between mental health and chronic pain. And so, they're both important to address because they go hand in hand. So, mental and emotional well-being can significantly impact overall quality of life, but it can also impact on the management of your condition. So, it's always okay to ask for support. It's absolutely important that we're able to address mental health concerns because it will lead you to living a more fulfilling, healthier life whilst effectively managing the condition. Anxiety and depression are very common and very complicated um, complications of chronic pain and arthritis. They both work in similar ways and can affect us negatively. And so, really getting a hold on them can be incredibly effective for the management of your arthritis. So, that brings us to the end today. If you have any further questions, please don't hesitate to send us an email. You should be able to access that in the follow-up email that comes out shortly. We love to hear your feedback, and so please let us know what your thoughts are. And also, we'd love to hear from you in terms of what you'd like to learn in the future, what webinars you'd like us to hold for you. And please don't hesitate to get involved and share your thoughts. Thank you.